Sir, we are live now.
Okay. Am I audible now?
Sorry, sir.
Am I audible?
Yes, sir. Yes, sir. You're audible. You can start with the session.
Okay. Okay.
Hello.
Yes.
Yes, sir. Are you facing any problem?
Huh?
Are you facing any problem?
No, not at all.
No, sir. You can start with the session then, sir.
We can start the session.
Yes, sir. Yes, yes.
Okay. Good evening, friends. This is Dr. Suresh from Bangalore. Today, I am taking the group through one of the common challenges a general practitioner or a physician faces is people complaining of insomnia or sleeplessness. What we do is today, all of us have come across different varieties of people presenting complaints about their sleep patterns. And we also know that generally what we do is prescribe some drugs, sedatives, or anxiety relievers, thinking that they are the problems. Therefore, my presentation today will try to take the group together 7 key points. One is, let us recapitulate the different stages of sleep, how each of that step helps, and what problems can occur in each one of them, what are the possible reasons, and in general, what are the approaches we need to take before embarking on prescribing any drugs. Then there are certain universally known, what are called as proven ways to fight insomnia. We also know that there are quite a few health problems that makes getting sleep a tough thing. Not only health problems, other social problems also. We look at the type of sleep that helps to restore our alertness and day-long work. This is important for us as the clinicians also, and to our friends. Now, with the pattern of day and night working nowadays, the challenges are becoming more difficult. A decade ago, when I was practicing, of course, this is my 56th year I'm practicing, I had not heard of people talking of to be awake in the night so that they can work and try to sleep in the daytime. They have to work in the night, because most of these IT guys work with the international online working. Their work starts late hours. So they all typical sleeping system of night is changing, particularly in urban area and in certain sectors. We also, medical people who are in the night duty, have to be awake in the night, can't afford to make errors because of sleepiness. So that apart, we need to know what helps to restore alertness whenever we need to work. Then there are common problem of people complaining, snoring. Snoring individual may not complain, but people who sleep with them, maybe spouse, maybe parents, maybe children, and sleep apnea. That is repeated waking up and sleeping for various reasons. We'll come to that. And how to make up when we are alert and fresh so that we can work. And there are other intricacies we'll go through. So today, I'm trying to equip all of us, because I would like to hear from you also if you are doing something different. How are we going to address this onerous challenge of making people to go and have a sound sleep when they want? The earlier days of saying that we want to sleep only in the night may not hold good, at least in urban areas. First, let us recapitulate our deep sleep stages. We all know there are 4 stages. The last one, which is rapid eye movement sleep. When we are deep asleep, there is a deeper. Before that, it starts with the stages, which is called as non-repetitive eye movement, stages 1, where it is a transition time between you hit the bed and actually fall asleep. Generally, it should take about 10 minutes. We also alert that if for somebody needs more than 20 minutes, probably it is better for them to get up and do something and go back to sleep after they get tired. The second stage is the time which involves the light sleep, where our body temperature and heart rates drop slowly. The brain begins to produce what is called as sleep spindles, and this stage will last for about 20 minutes. Stage 3, where our muscles get relaxed, blood pressure and respiratory rate drops down further, and there is a beginning of sleep. This stage will take another 45 minutes. In the last but the most important stage, their brain becomes more active, body is relaxed and immobile. You may have dreams also, and eyes move rapidly. That is why this is called rapid eye movement sleep. Now, in the first stage, as we are told, takes about 5 to 10 minutes. The second stage takes about 20 minutes. Third stage around 45 minutes. And the deep sleep another. And each of these cycles are maybe in the range of 1.5 to 2 hours. So every time you wake up, the things may start again. Now here we are depicting the same stage, and what I have added in the green here is what does it do to our whole system as a human beings. For example, stage 1. Most important is stage 3 in terms of importance. We're not going by stage now. It is stage 3 or non-repetitive eye movement, are also known as delta sleep wave. It takes about 25% of overall sleep cycle. As I told you, our sleep cycle consists of about 90 minutes, 110 or 120 minutes. And this one, it restores, helping our bodies heal themselves and minds also reset. Next importance comes is the rapid eye movement sleep, which is the deepest sleep, stage 4. The role of this category of sleep is in dreaming, memory, emotional processing, healthy brain development. This sleep plays an important part in restoring alertness and ensure a person's optimal functioning next day. So if you get your deep sleep disturbed, next day your working will suffer. In stage 2, what happens is brain waves continue to slow down and there are bursts of rapid brain activity. These are called as sleep spindles and K complexes. These bursts play a role in long-term memory. That means you keep recalling at this moment what important happened in the day. They consolidate and do a sensory processing to protect the brain from waking up from sleep, so that once you wake up and go back to sleep, that should not worry you for the rest of the time. There are generic proven ways which our forefathers used to tell us. There is no need for any medical knowledge here. As I told you, the deepest stage is very important. In each, our iris of the eyes moves rapidly. This may happen for about 90 to 120 minutes. Our heartbeat is faster and irregular in this stage. Body is inactive. Whereas third stage, our body enters in 30 to 45 minutes after sleeping. This we already discussed. So to improve our stage 4 or so-called deep sleep, physical exercise is very important, a generic principle. That means if you are working out daily at a certain fixed time, especially in the evening, is likely to help your sleep patterns better. Eating more of fiber in your food instead of eating only the processed food is another way of improving our sleep. Therefore, visiting lots of leafy vegetables, fruits would help us. Then find your inner yogi. That means, how do you meditate? How do you calm yourself? Is an individual choice. Some people may think of music, some people may think of some important work turned out for the day that gets you to the inner happiness which leads to sleep. Avoiding caffeine, either coffee or tea, at least about 7 hours before hitting the bed. That means if we are hitting the bed around 11 o'clock in the night, I think that is a common time which has become nowadays. 7 hours before that, these stimulants like coffee and tea should be stopped. So you have an option of having your evening tea by 4 or 5, and beyond that, that will be restricting your sleep. We have to resist the night cap. That means the moment you feel, whenever you eat, you always feel a little nappy and we take a nap. If we can avoid that, your sleep will come faster, somehow pull on to your scheduled time. Of course, a relaxing bedtime and bed routine is very important. And your bedroom must be what we call as a sleep sanctuary. It does not mean you should have only 5-star, 6-star mattresses and beds, but where you feel comfortable. People are there, can comfortably sleep only on the floor, especially in summer. In the winter, you may need warm cloth. So you need to see what makes you comfortable so that you sleep well. Listen to white and pink noise, that means very light music, that helps. Now, before we go for diagnosis and management, let us look what are the situation in general in the country. I am quoting just 3 studies which have brought up understanding about the problem of insomnia in Indian population. One is what is called as sleep-related disorder study done in 2011, that means about 12 years ago, where the people who were interviewed were between the age of 28 to 45, that have with an average age of 35 years, plus or minus another 9 years. Most of them, they slept for about 8 hours, plus or minus 1 hour. And this, of course, has a reasonable representation of all South Indian states. Most of the respondents did not report any medical or psychiatric problems. But general health condition like hypertension was seen in 42 or 43%. Heavy body mass index of more than 25 was observed in 25% of the people. And neck size of more than 20 centimeters, which indicative of your heaviness, was there about in 7.7%. Their daily consumption tea was 70% of them said they consume tea, whereas around 18% consume coffee, and another 22% used tobacco. Their average time to fall asleep was 22 minutes. That means they said after hitting the bed, they may need about 22 minutes, and the range was as short as 5 minutes and as long as 90 minutes. Average duration of sleep was about 7 hours, and most of them reported good quality sleep. The sleep-related disorders were around 20% to 35%. The commonest sleep-related disorders reported was narcolepsy, restless legs syndrome, obesity was not associated with these diseases. 18% of them had difficulty in initiating sleep. Another 18% has maintaining sleep, and 8% woke up early in the morning. So nearly 54% of them had one or the other problem. Respond attributed to insomnia to mostly depression or anxiety. Of course, insomnia was more among females because they probably worried more about the family, the children, the financial situation, so many other things, with a difference of about 2% between the men and the women. Again, the depression was the major reason. Restless leg syndrome was maximal at night, was responsible for delayed sleep onset in majority because they worked heavily daytime. Probably the legs were tired and the muscles were twitching. Some people complain of night terrors, suddenly getting up with some bad dream or something, nightmares, and other sleep talking, sleep shouting. Most of us also hear our people who sleep with us doing these things. Family history of is present in 1/3 of all these people. That means it almost runs into families in 1/3 of the cases. A second study, which was done recently in 2021, reported chronic insomnia of 33% among the adult population. The age and diabetes were significantly associated with insomnia. Socioeconomic factors, the worries related to economic conditions, social conditions, jobs, discrimination by caste, gender, or religion, and comorbidities were not significantly associated. Please note that 20% of the patient did not pursue, they have a problem of sleeping. They say, okay, it's fine, not a big deal. We also know the third study reports during the COVID-19. The study was done in between May and June 2020, about 600 people. Here, this was done in the most northeastern part of the country in Manipur, where people are internet users, friendly, about 40% of them. And here, the overall insomnia was present in about 12%, mild insomnia in about 32%. Females again had more problems. And here it was highly associated with what we call an internet addiction. That means people looking at that mobile phone for lots of information, good, bad, worse. We all know what it means. Let's come, how do you handle it? This theory is fine. So what we do is, when a client approaches to you, the common complaints may be the person is finding it difficult to fall asleep. We say difficult when it takes more than 20 minutes after hitting the bed. Or they may complain that I sleep, but I get up quickly, get disturbed. So staying asleep is difficult. Some people have both. Both are a problem. Waking earlier than they desired and not able to get back to sleep. People get up, sir, I got up at 4 o'clock to go for a toilet. When I come back, I find it difficult to sleep. I'm sure many people complain, particularly elderly people. If nocturia is a problem, this is going to be much more complicated issue. Diabetics, where frequency of urine passing is there, and then if they don't get back to sleep, it creates problems. People sometimes complain of poor quality, that means light and unrefreshing. I slept, sir, I slept very well for 8 hours, but still in the morning I'm feeling drowsy. That means the quality was poor. Feel tired when they wake up, despite all saying I had slept for 7 hours, 8 hours. They say my day is still, I'm continue to feel tired. And general complaint usually is it saps their energy level, mood, work performance, and quality of life. I don't know, sir, what is the problem, but I cannot concentrate in my work or even entertainment. So my energy level, I feel I'm always tired. So if any of these complaints, it's for us, the general practitioner or a specialist. Today we are going to concentrate more on general practitioner, though we do make a mention of what extra things can be done and needs to be done. We need to suspect insomnia or a type of sleep disorder and try to investigate. Generally, we say duration of sleep's adequacy varies from person to person, but most adults need about 7 to 8 hours of sleep. Younger the age is more number of hours. Older the age, for example, my age of 78, I hardly sleep about though I am on the bed between 11 p.m. and 6, the actual sleep will be only for about 5 hours. The remaining 2 hours will be tossing around. So insomnia, generally we talk in two categories. One is called as primary, as you know. That means it is not associated with any other health condition, other problem. Secondary insomnia is related to some of the condition we suffer. It may be pain in the body, it may be cough, it may be breathing difficulties, it may be joint pain, muscle stretches, pain here, pain there. And sometimes the medication we take, we forget. And sometimes taking a lot of substance use, maybe it alcohol, any other thing, they feel they get a good sleep, but actually it disturbs sleep after initial drowsiness. Technically, we classify insomnia into three categories. Transient insomnia, which is for less than a month, for various reasons you may be facing in the social or economic life. Once the situation improves, you automatically go back to your routine sleep. Short-term insomnia is when things change between 1 month and 6 months. You're being disturbed by something or the other. And we call it chronic insomnia when the problem lasts for more than 6 months. When do people come to us? Only when it makes them either difficult to sleep for long hours or it makes their day activities difficult. These are the categorized symptoms and signs which we have already gone through earlier. I would not repeat. You can recall yourself how many of these complaint people have come to you in the recent past. I am sure most of you who are there in the practice for more than 2 years would have come across all categories of these complaints relating to sleeplessness. So what do we do? There is no magic band or a rapid test or a radiological test to diagnose insomnia. We all know. So diagnosis, there is no standard pattern. What we have to do is ask about their sleep habits. Then, if the recall memory is a problem, what we ask them is to maintain what is called a sleep diary for about 2 weeks and come back. What does sleep diary contains? It takes when did they sleep, hit the bed, when did they go to sleep fast, when did they wake up, what they did just before sleeping, how much time took. So there are detailed sample diaries where they can maintain. That should help us in calculating the total sleep time of the individual. Second, it also helps us to what disturbs and the sleep of the individual and the quality of the sleep. Then you also look at what are the patterns that explain his problems. For us, we have to concretely entries are needed to understand, because just listening to the individual may not help fully, because the source has to be trusted. Then we may also have to look at their sleep environment. Where do they sleep? How sound it is? Where it may be. Now we are working from home. Most people come to you. Now, very often people work on their bed. Your body needs a separate identified place for sleeping. You cannot work and sleep on the same place. So therefore, that becomes very important in the modern era. Room temperature should be around 70 to 60 to 70. This may not be conducive during the seasonal variation. In the month of December and January, you know, there is a winter. It might have problem for some people. Some people might enjoy. In summer, some people enjoy, and some people need AC. Even using AC becomes difficult. So the environment, how conducive can we make? Then look at the noise disturbances. One can use earplugs if you cannot minimize. Then the rooms have to be dark. If there is a bright light entering from the street light or somewhere, sure, you will not get to sleep fast. Cleaning the bed sheets regularly. If not washing will be done once a week, but cleaning and clearing it of dust, etc., before you sleep is a good habit. Some people may like to use some aromas in the room, lavenders or lemons of individual choice. Once you analyze the cause of insomnia, what as a clinician you may like to do is basically 3 steps. Healthy lifestyle habits such as regular sleep schedule. Going to bed daily at the same scheduled time, getting up at the scheduled time. And of late, most importantly, what is becoming is called as cognitive behavioral therapy. And the medical support or use of medicine should come as a last resort. So we are going into little details of what these, if you need to do an analysis. Sleep log, it is a simple diary that keeps track of details about your sleep. When did you hit the bedtime? When did you wake up? How was your sleep quality? Did you sleep anytime during the day? And any other detail. It figures out what might be causing the insomnia. The second option we have is what is called sleep inventory. This is an extensive questionnaire you keep asking about his personal health, family health, occupational situation, earnings, are there any worries, medical history, and sleep pattern. Now here, some people may give history, some may not. So this becomes unreliable. The biomarkers, basically we do only for thyroid profile, which might disturb sleep. And we also know diabetes, as we know that because of the frequency of maturation. Among the elderly people, you may do prostatic hormone studies. If these are not possible, there are sleep studies to be done. You may wonder, can we do sleep study at the individual level without any equipment? Yes, it is possible. Initial sleep studies can be done. But if that doesn't help, then you may have to refer it for what is called as polysomnography to gather information about the nighttime sleep. Here, the patient sleeps in a laboratory on a comfortable, apart from ECG, there are other records measured like oxygen level, body movements, heart and breathing patterns. This is a non-invasive study. It is becoming very common in urban areas. The moment you complain insomnia, people are referring for sleep studies. But that is not help routinely. It's only when you exhaust the simple interactions, you need to take care of that. There are other advanced methods of studying what is called as actigraphy. This is a special device where it is worn on the wrist and it monitors the entire movement during the sleep. This is more objective study than sleep diary because here the person is not involved and he or she does not have to write on their own. Everything gets digitally logged in. Sleep questionnaires, which we already said is something which we can do in the absence of this. There are of late wearable activity trackers. You can use your mobile phone and other sleep trackers. But as an individual practitioner at the smaller institution, this may not be feasible. Now, based on the type, you can diagnose insomnia into 4 or 5 categories. First is what we call as psychophysiological insomnia. Here, there is a heightened arousal with excessive worry and focus on sleep. So I can't sleep today because I did not work. I can't sleep today because today something is keeping worrying you. And then more you worry, the more your sleep runs away from you. So it is psychophysiological insomnia. Then there is idiopathic insomnia, which is long-standing, basically has genetic background, often beginning in the infancy or childhood. Some people say this is from right my younger days, school days, college days, and February. Then third category is known as paradoxical insomnia, where some people, there is a misperception. They feel that they are not slept despite sleeping for 8 to 10 hours. So the complaint is only paradoxical. They feel they have not slept. Another category is depending upon what we call as sleep hygiene, disturbing the sleeps, which includes taking naps in the evening, taking stimulants, then using bedroom for non-sleep activities. Here, people sleep lightly, and during the day, if you see from home, we know you all have this problem. Last, most important category is behavioral insomnia of childhood. Here, it sets up in the infant stage. You might have heard many parents coming to you, child does not sleep at all, keeps crying the whole night. And it may get into the toddler stage, adult stage also. Looking into summarizing the causes of chronic insomnia, as we already discussed, the first comes is the stress about work, school, scholastic performance, health issues, finances, family worries. They keep your mind active in the night. Or there may be certain life events or trauma, death or illness of a relative or a loved person, divorce, job loss. All these cause stress, in turn affect you. Some people come over this issue and get back in a few weeks. Some people may suffer long. That is why we say whenever you meet the persons, did you reconcile with what happened? Reconciliation is the word when we use. If people say that, okay, this had happened, I was worried, but I had to move on. Somebody even says, yes, it happened, but we had to move on. So stress is the most common cause of primary insomnia. Travel and work schedule, we have discussed already. People have to work because their internal clock is used to sleep in the night. Now an engineer, IT guy has to work starting at 4 p.m. into midnight or early morning. So their cardiac, what we call as the circadian rhythms, may get disturbed. This also happens when you travel from one country to another country, different time zones, working late or night shift, and frequent changes in the shifts. Poor sleep habits, as I've already discussed, bedtime schedules are not there. People take a nap in the evening, take tea or coffee before bedtime, take heavy lunch dinner, keep watching TV till 12 o'clock, keep playing video games. So all these are poor sleep habits. They keep you awake. Eating too much late in the evening, that is why we suggest that people should not eat anything at least 2 hours before you hit the bed. Sometimes you may get into what is called as heartburn or esophagitis due to the sphincter being little loose between stomach and esophagus. The acid content may creep into esophagus and get the heart pain. There are certain medical conditions, basically all related to cardio-renal respiratory issues or mental distress. We know what lung cancer patients, diabetic people, hypertensive, asthmatics, gastroesophageal or what is called as GERD diseases, overactive thyroid, Parkinson's, these are all likely to become a primary cause. And maybe these are the ones which will lead to the diagnosis. They don't come with the disease, but only when you investigate. And generally, these conditions are amenable to if you treat the primary cause. Mental health disorders. Now, this is one stress cause. A beautiful diagram which I like, that if we force people to sleep only less than 5 hours, what happens is next day you eat more, you feel hungry. The relationship here is hormones and cytokines and other substances that drive the sleep hunger axis. How and why it happens, it is not clear, but it is very well known. And this leads to eating disorders on one side, which leads to preference for hypercaloric foods, sweets, ice creams, etc., etc. Then poor impulse control, therefore sleep disorder. It may also lead to HPA axis activation, where there is a cortisol decrease, which impairs the sleep. Then there is the insulin resistance, adiposine. Then there are hormones called as ghrelin and leptin. They all lead to weight gain, then increased appetite and food intake, the risk of diabetes, obesity, and the obesity pressing on neck, resulting into stress against deep sleep. Primary sleep disorder basically are two categories. One is called parasomnia, where you have abnormal activities during the sleep, such as sleep terror, sleepwalking. People shout in the sleep, save me, as if they are sleeping something is happening in their deep sleep. So you get up, make them get up, and afterwards they may feel sleep or they might take some time to sleep. The second category is usually called as dysomnia, where they have difficulty in falling asleep or staying asleep. Example, obstructive sleep apnea. So these are basically due to central nervous system abnormalities, periodic limb movements in sleep. Here, people keep moving their arms and legs frequently, involuntarily. There may be certain jerks, flexes. This may occur several times for several hours. We do not know the cause. Because of this, daytime sleepiness and fatigue becomes and interrupts their daily routine. Then there is a common one is known as restricted restless leg syndrome. It's a neurological disorder. It causes leg pain, crawling, feeling in the legs, or an urge to keep the leg moving forever. What we need to do is ask people to sit down, because when they lie down, it increases. They can walk around, moving legs for some time till they get tired. Usually these symptoms are more in the night time. The other way of looking at is, according to the type of patient we see, the insomnia or sleep apnea are basically related to aging people. So we look at the aged people who come to you with this complaint. Here, there is a change in the sleeping pattern. As the age advances, people become less sleepy. For them, even a little sound may disturb. And they change in activity because they are no more socially active or physically active. This lack of activity can interfere with the good night's sleep. So how do you help them? Walking, ask them to walk, ask them to take an evening bath before they go to bed. So keep the body active, warm. And if the elderly people have any chronic pain, could be arthritis or depression. Nocturia, we already discussed enough. People have to go to the bathroom thrice every 2 hours. And the types of medicines they are taking, some of them are also known to. So you have to handle them separately. Then we talk of sleep apnea. Many people even don't know. One of them is we call as snoring. If you ask the person, he may not know. Only people who sleep with them, spouses, children, may tell about snoring. Snoring is not. This basically begins with a blockage in the nose. There is no connection. So there is a weak muscle tone. Either excessive alcohol or deviated septum, anyone can cause sleep apnea, snoring. Person himself, as I told you, may not be able to tell you. You need to get this information from people who sleep with them and then help them how to handle that. One study in India indicated that 20% of men and 12% of women over the age of 30 have snoring habit. That means men snore more and louder. The other problem of apnea is what is called as morning headaches. Here, people do not complain of apnea, but they complain of everyday morning headache. See, what happens here is a physical obstruction in the airway or the brain nerves properly controlling your breathing. Each episode wakes them up, and then in the morning, since they did not have enough sleep, they get headache. So main complaint may be only morning headaches. Third categories are called as lingering fatigue or sleepiness. That means they constantly feel tired. That means they did not have enough sleep. Inability to focus on certain activities in the daytime may lead to accidents. Some people wake up suddenly out of breath. This unexplained jolt is not yet clear. So sleep apnea left untreated can have serious health consequences. Therefore, they need attention. What can we do for sleep apnea? We need to understand what are the causes and address the causes. It may need a sleep study in the laboratory, attend to the medical background, and help them with some medicines. The health conditions which are associated with insomnia, cardiovascular, especially coronary angina diseases, hypertension, weight gains, all of them we know. And unless we address the basic problem, sleeplessness will not be helped. So what happens in obstructive sleep apnea is there is an intermittent hypoxia. Sleep gets fragmented. That leads to sympathetic activation, oxygen stress, systemic inflammation, hypothalamic or pituitary axis action, and adipose dysregulation. Therefore, this leads to insulin resistance, and most diabetic and hypertensive are involved in this. So unless you control those basic issues, you may not be able to help only the sleep. So let's quickly go to the treatment component because I leave next few minutes for you people to ask questions. There are two approaches, non-medical, which is cognitive and behavioral therapy treatment, and medical is using certain drugs. Relaxation training and progressive muscle relaxation can be taught by anybody. This helps to calm and induce sleep. Breathing exercise, mindfulness, meditation, and guided imagery can help. Many people listen to audio recording, which guides them to sleep. Stimulus control. If there is any stimulus around the sleeping area, reduce that at least 20 minutes before. And if person cannot sleep in 20 minutes, better he should get up and work and get back to sleep when he feels sleepy. Cognitive behavioral therapy includes behavioral changes. We'll come to that later. And avoiding caffeinated beverages near bedtime, this we have already discussed. The basic medications prescribed, probably you people know more than I listed a few common drugs which we use. You can use it, but please see that these are prescribed as short duration as possible, not more than 2 weeks at a time, and slowly withdrawn. Don't withdraw suddenly. We did talk of this in my previous talk of some of these drugs. So in the management in elderly involves both psychological behavioral therapies, pharmacological treatment, or combination of the both. When you come to children and adolescents, what becomes more important here is both going to sleep or staying asleep, or they feel not well rested. It may lead to aggressive behaviors, decreased attention span, depressed mood, hyperactivity, irritability, memory problem, mood swing. Children between the age of 6 to 13 need about 9 to 11 hours of sleep, and teenagers may need about 8 to 10 hours of sleep. Now, children insomnia need to be better managed by the adults at home, setting certain firm limits. When do they sleep? When do they get up? When they can see TV? When they can see their mobile? Things like that. These sleeping aids for children should include sticking to a time schedule, exercise during evening hours or morning hours, having a screen time cutoff, minding the lights, calming their fears, establishing a pleasant bedtime, drinking warm beverages, and incorporating essential oils. As far as possible, please avoid drugs. Sometimes you may prescribe antihistaminics. So basically, this picture tells you how to sleep more, decrease ambient light, good bedtime routine, limit electronics, less caffeine, more exercise, set some time goals. What is sleep restriction therapy? That means here you are making them to be on the bed for hours they actually sleep. Many people say we are on the bed for 11 hours, but actually sleep for 6 hours. So this says you need to restrict the sleeping time and the bedtime to same. That is what known as sleep restriction therapy. This is a behavior.
Hello. Hello. Hello, sir. Am I audible? Hello.
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 Yes, am I audible?
Yes, sir. Yes, sir. You are audible. Do you want
Okay,
me to
my
share this slide?
presentation is over. If there is any queries, you can call.
Yes, sir. There are some questions are there. I will be posting one by one questions in the chat.
Go ahead.
Yeah. Sir, I have posted the first question.
Okay. I can't see the question. It disappeared. Can you repeat?
Yeah. I will just read the question for you.
Okay.
How is insomnia not due to substance or non-physiological condition diagnosed?
Can you repeat that?
How is insomnia not due to substance or non-physiologic condition diagnosed?
Basically, as I've already told, we need to look at the sleep patterns. When does the person go to bed? So maintaining a sleep diary in the general practitioner, asking people to maintain their sleep diaries and the event before they are going to bed will help us to find out what are the reasons for insomnia. Then accordingly, we need to address.
Hello.
Yes.
Yeah, sir. We have the next question now.
Okay.
Sir, you can just keep the device far from you because your face is not visible.
Okay.
Yeah. I will read the question now. What are the American Association of Sleep Medicine treatment guidelines for insomnia? Hello.
The treatment guidelines, as I told, analyzing the sleep patterns. Hello? Hello?
Yeah, sir, you are answering this question.
Okay. Basically, the suggestion is to analyze the sleep pattern. Second is start disciplining first what we call as the sleep hygiene be improved. That means time scheduling, getting up, exercise, diet, avoiding stimulants later in the evening. Then second is if there are any medical reasons which are the reasons, treat the original medical treatment. Finally, the role of drugs which are basically sedatives comes into picture. This is the standard guidelines of late.
Yeah, sir, we have one more question. What is the role of cognitive behavioral therapy for insomnia?
Cognitive, nowadays this cognitive therapy is taking a much larger role. In fact, there are super specialization only for sleep therapies. Therefore, as I was telling you, the use of drugs should be the last resort and for shortest duration whenever we use. Cognitive therapy goes into step by step. There are 7 steps to be followed. For want of time, I did not get into the details. To help the person, first is realize that there is no big problem with him. If he schedules his timings for going to bed, getting up, eating, etc., and then finding what is called as mindfulness. Think positive, never get only negative. So that has a much bigger role nowadays in treatment of insomnia.
Yes, sir. We have now last question. What are the general precautions regarding the use of sedative hypnotics for insomnia?
Okay. As I was telling you, the drugs, most of the drugs we use are habit forming. We all know that. Therefore, these drugs should be used for as short time as possible. And there is a limited upper limit of the drug for each one of them which can be used. You cannot use heavy dose just because some person says that was not useful. Then some people say keep on increasing the dose. That is not good. And no drug should be continued, especially benzodiazepine drugs, for more than 2 weeks. If you are using for longer period, stopping also should not be done abrupt because they have a withdrawal syndrome. The stopping also needs to be done in a phased manner, which we discussed in my last presentation of the benzodiazepine drugs presentation sometime back.
Yes, sir, we are done with all the questions now.
Okay.
Yeah, and thank you very much, sir, for your valuable time and sharing important insights on the topic, sir.
Thank you. Thank you very much. So we will go out. Thank you.
Yeah, sir, you can log out now.
Okay. Thank you.
Thank you.